And Dr. Muktinder Singh also joined.
Over to Dr. Shweta Singh to moderate the session.
Thank you so much, sir. Hello, everyone. Hi, Dr. Shweta Singh welcomes you all in 2047th day of uninterrupted daily webinar conducted by International Forum for Promoting Homeopathy, an international homeopathic humanitarian organization formed to bring together the global promotion of homeopathy and to bring together homeopathic movements, activists, and activities worldwide under one umbrella. I'll be the moderator of today's session, and our participants are homeopathic lovers, students, and doctors. Let us begin the session with 1 minute silent prayer. Thank you, everyone. Today, we are going to have a panel discussion on From Similia to Science, the everlasting legacy of homeopathy. And let me introduce our esteemed panelist to all of you. Dr. V. Karnakar, Medical Officer, Government Homeo Dispensary, Nellore, Andhra Pradesh, former Assistant Professor, Government Medical College, Kadapa. Professor Dr. M.K. Sahani, sir, former Chairman, Education Committee, CCRH, New Delhi. Dr. Subhash Singh, sir, Professor, Organon of Medicine, NIH. Professor Dr. Muktinder Singh, sir, Professor, Solan Homeopathic Medical College, Himachal Pradesh. Homeopathy, founded on the timeless principle of similia similibus curantur, let like be cured by like, stands as one of the most profound and debated systems of healing in medical history. From its origin in the visionary work of Dr. Samuel Hahnemann to its continued global practice today, homeopathy has evolved through centuries of clinical observation, philosophical depth, and emerging scientific inquiry. This panel discussion aims to explore the dynamic journey of homeopathy from its classical roots, grounded in individualization and vital force, to its interface with modern scientific advancements such as molecular research, nanotechnology, and evidence-based medicine. It invites a critical yet open-minded dialogue on how homeopathy maintains its identity while adapting to contemporary healthcare challenges. As we bridge tradition with innovation, this discussion will reflect on key questions. How can the principles of similia be interpreted in the light of modern science? What is the role of homeopathy in integrative medicine today? And how can its legacy be preserved while ensuring scientific credibility and global acceptance? Through expert insights and interdisciplinary perspectives, the session seeks to illuminate the enduring relevance of homeopathy, not merely as an alternative system, but as a living, evolving science of healing. So my first question to our panelist, Dr. V. Karnakar. Sir, what are the biggest challenges you face in demonstrating the efficacy of homeopathy in daily practice?
Yes, good evening to all. However, it is a great honor to participate the great stalwarts in panel discussion, Subhash Singh sir or Sahani sir or Muktinder Singh sir, all other things. So straightforwardly I come to, because of time, lesson time. So I have experience of 20 years in practice of homeopathy as a lecturer, as a medical officer. So I have strong confidence towards the similia principle. Yes, 100% it is definitely a legacy of our similia principle from the generation or the mind of Hahnemann's thought. So the compilation of all lacunas which were existing in the medical professions, he constituted the similia principle for providing permanent cures. But when we have to introduce or come to the practical orientation of mind, so the patients are not in a position to accept, even in spite of the patients are benefiting by taking the homeopathic system of medicine on the basis of similia, again they have started a doubt of benefit because of a domination of contemporary principle, means allopathic mode of treatment. Some people are even they have interested to use our homeopathic system because of fear. In any emergency conditions, we approach the contemporary or other profession, they are accepting. Many times I advise to my patient, the first question which has arised the minds of the patient, he was on treatment for some other problems, either chronic diseases. He has raised a question, I have to stop this medication or not. So many a times there is a chance to stop the medication to allow the pure action of our homeopathic medicine. But early stage of my practice, I allowed to stop immediately and we have treated. So all of a sudden, is it any emergency condition has developed? When they have taken the history, I have some diabetic or some hypertension, some problem. After starting using homeopathic medicine, I stopped that one. So most of the allopathic people were rejected those cases to take up that one. So as a doctor, I don't trouble to my patient. So why? Because I stopped the medication. I have shown best efficacy of our homeopathic medicinal action and positive result. In spite of that, patient has developed a fear when he approached the contact. This is the first challenge I have to face. Since the time I have to adapt it, I never stop any medication. I have to show a positive result in the patient's economy, and I advise it to go your physician and examine. They are reducing the dose or they are advising to stop the medication. It is the best methodology to the patient, to the homeopathic profession. Why? Because they are more experts to recognize the efficacy of homeopathy compared with our homeopathic physicians. It is my strong belief. And also, patient has a strong belief or he has been continuing the homeopathic treatment when allopathic physician insisted. Even though I can assure many a times, but he is not even little bit, there is a confusion in his soft mind. This is the what I have heard. So this methodology has given best result in my experience, and patient also very happy. Allopathic. Recently, one case is also, he had a right atrial myxoma, 3.5 centimeter is there. So a cardiologist advised surgery. He was having diabetes or hypertension, some other problems. He was doubt of benefit after surgery. What will be the prognosis? He has given time for 3 months. 3 months time. After that, he come to that. The same case approaching me, is it any possibility is there or not? I open-mindedly stated that, yes, sir, I have a good therapeutic agents in homeopathic medicine. If you please give me a chance to me. Your physician, cardiologist has given time for 3 months. Please give that time. I treated that case. If there is a positive result, you have to stick on. After decision of your cardiologist only. Yes, he has taken treatment confidently. After 3 months, he went to the cardiologist and taken up that entire investigative procedure. He was observing tremendous change, 3.5 to 1.5 centimeters. He stated earlier there is a need of surgery, but now what you have used, there is no need of surgery in the present state. You have been continue the treatment further 3 more months, and after that he will come. He has came to me happily. I have been continue the treatment like that. This is the one thing. So this is the first point. What I have faced. Even some patients, they have benefiting homeopathy, still they are using some unrelated words. Homeopathy is a slow, homeopathy is producing some other problem or some whatever. The outcomes which are resulting in their body reactions in the cleaning process of the disease, they are not understanding. So it may be, they thought it may be a new problem or they thought some other things. So they are not sticking. Or middle of that, they have disturbing the some other things is also because of overthinking of the patient. I'm facing many results are not getting properly because of overthinking of the patient. And even clearly I insisting, this is the method of modus operandi. This is the first symptom you have changed in your economy after taking this remedy. Later this one, I have clearly explained to the patient, even they are not observing, they are always prejudiced ideas. I am not getting results, sir. I am not getting results, sir. I have to go to the checklist. Initially, I have depressed, but later on, why I have failed? I have prescribed a right remedy to the patient like that. I have started to the checklist. There is a little bit result is there, sir. There is a little. So, because of prejudiced ideas of the patient, we are not test the efficacy of or fruitfulness of the homeopathic result. This is another important one. Another one is So in allopathic or other system of medicines, they are ready to continue for longer time of period. In the last stage, they are approaching our homeopathic system. They are not having patience to wait for to exert our system of medicine few minutes or other things. So even I explained many times, this you are approaching in last minute, it takes a time for that one early stage you have come to that 1 hour. And another experience what I have faced, he get the better result in one particular aspect. Recently I have treated one case. He was lost entire his complete taste bud damage occurs and he was lost complete taste. So he never felt any taste except sweet. So he was treated almost all neurologist, endocrinologist, all other things. He was approaching me. I clearly stated it takes time, 3 months time. Why? Because the function is developing in our tongue. It takes time. Yes, within what I have defined time, he has developed clearly all tests. He was enjoying very last and give simple remedy also. But again, he has started after 3 months. Diarrhea he has started in that one. He was used. He never come to me. He was going around all gastroenterologists, all other things. Every day he was passed 3 or 4 times, but he never approaching me. After last minute, all treatments were failed. He was come to that doctor. Namaskaram. It is unfortunate thing. Earlier I got good result, but I was moving all other things. This is my problem. So even he was stick on to that one, he never stick on. He was insisting us to give immediate result. How we can give immediate result? So we are damaging deviation far away. So there is a time, similar time, how much time taken for deviation, the similar time has taken to reach the same place to restoration means. This is another important change. So here there are three things from the patient, from my point of view, sometimes all are looking similar. When I fail, I am not having sufficient knowledge or reading with Metromedica, I fails to differentiate a little bit. So sometimes there is a common symptoms. Sometimes there is no symptom at all. Sometimes I depressed. Which remedy I have to give? Many times I follow Hahnemann principles. So what is that one? It is a chronic case. It is acute case. It is a one-sided case. What are the guidelines he have given? I open up. Or in Metromedica, I read one statement in Master Kent Metromedica. If you are not getting clear symptomatology, indications of any remedy, to open up that remedy with palestilla or sulfur or sorinum, I have to follow these 3 remedies. Which one is exactly suitable to that one? It is open up a clear-cut symptomatology. Open up. So thorough. So that's why I suggested every day you have to read Metromedica. There is a different type of understanding. Even the same symptom. Why? Because the same symptom is expressed by the patient is different. When you are not thorough with to convert that symptomatology, if you are not keen observe that one, we are unable to select a simillimum. So when you are not select a simillimum, we are there. So that's why constant read. Whenever fails, I open up the Metromedica, I open up the repertory, I referred. So why it is failed? Remedy is similar, but fails to get one. So while reading the Metromedica, small statements are there. Even though it is a similar, it doesn't work completely. When it fails, even though it is similar to the case, you have to use the next remedy. Such a beautiful statements are there in Metromedica. When you have thorough with those statements, we are able to prescribing the remedy. So that's why I was facing these are the difficulties in the patients. So I have explaining to them, even every day I got depression. So even one patient, at least they are come to the same approach. So these are the things, man.
Thank you so much, sir. Indeed, fear remains a very big challenge if it is in the physician while practicing homeopathy, whether it is a fear of uncertainty in remedy selection or the pressure of clinical outcomes. However, it is the positive outcomes, results and successful cases that gradually build our confidence and reinforce.
Even one submission, madam. I have many patients. I have checked our homeopathic medicines. I am putting on the tongue. Wait for a few minutes. Out of in acute cases, definitely out of 50% of cases, patients gets within immediately fraction of seconds. They are clearly, few patients are clearly explaining this is I have cross-questioned either because of the sake of physician, you have to say answer good result is there, or you are really get it. So we want to know there is a clear-cut procedures explained, Hahnemann, either it is a point nature or it is a true or reality. So even patients are not believing that much result exerted by our remedy in that one. This is a unfortunate thing to our homeopathic people.
Yes, sir. Thank you so much, sir. And my next question is to Dr. M.K. Sahani, sir. Sir, how do you interpret the principle of similia similibus curantur in today's clinical practice?
Thank you, Shwetaji. This is good that nowadays everyone is looking for the very fast. And most of the things that I have observed among the practitioners, especially the newcomers, they want the fast results. And they try to copy the allopathic system of the medicine. And this is becoming one of the dangerous challenge for the homeopathy. So, as you know that the principle of similia similibus curantur is not just a guiding rule; it is the heartbeat of the homeopathy. In today's clinical practice, I see it as a deeply dynamic and individualized process, rather than a mechanical symptoms of the matching the symptoms. So, in modern healthcare, we often see diseases often being treated based on the diagnostic level, and this is also being followed by our own practitioners also. However, homeopathy invites us to go beyond the name and of the disease and understand the person who is suffering. Each person expresses illness in a unique way through their sensation, that is emotions, then their reactions, and even their experiences. So instead of looking at these phenomena and concentrating only on the pathological reports, it is not applicable for the homeopathy. So what I see that with this, for applying the similia today, we have to be careful perceiving the totality and finding a remedy that resonates with the patient as a whole. This is the reality. So, in fact, of the age moving forward towards personalized medicines, homeopathy always has been ahead because individualization is not a new concept for us as it is our foundations. So, I will suggest that even this similia is relevant to today, and it is more meaningful than ever now. So, with these concepts, it is important that students who get admission in the colleges, they must have the practical internships in their colleges, and they should, most of the time that councils and NCH has designed about the courses, applications, and the practical classes and the clinical classes. So more emphasis is required for the clinical classes so that the patient students get an exposure so that he can get confidence in the homeopathic system of medicine. And another thing that is most essential, that is the perseverance that is required for the homeopathic practitioners. So I hope the college level, educational level, it has to be taken. They have to take the initiative because they are the they have the responsibility of providing the basic educations to them. So I think it is relevant, yet it is challenging for today.
Yes, sir. The similar principle is truly the heart of homeopathy, and as a system progresses, we must ensure that we do not lose its core essence, that is a unique, personalized approach to the treatment. And thank you so much, sir, for your reviews. And I'm going to ask Dr. Subhash Singh, sir. Sir, how do recent developments in molecular research and nanotechnology support the scientific basis of homeopathy? Dr. Subhash Singh, sir, are you there?
Can you repeat, please?
Yes, sir. Sir, how do recent developments in molecular research and nanotechnology support the scientific basis of homeopathy?
Thank you very much. Before I answer, just let me put my situation. I am actually coming to Delhi to attend the WHG program.
Yes, sir.
So the network is not very stable, and I'm hearing some, and then I'm missing some of the things. What I heard from your question is that about the recent researches in nanotechnology and how it affects the homeopathy and what is the relationship with homeopathy.
Yes,
Well,
sir.
whatever research in the modern science is going on, it directly do not influence or directly do not affect homeopathy. But in some way, we are looking forward to get our validity being done by the researchers that I work in National Institute of IIT Kharagpur, Indian. We have done research. Some nanoparticles are present in the medicine, and one of the medicine was being investigated whether in the 50 millismol potency.
I think we lost the connection.
Dr. Subhash Singh, you are not audible, sir. I think he's disconnected.
No, he's there, so
So yeah, he's disconnected, sir.
so you're not audible. Can you please unmute yourself?
No, Dr. Subhash Singh is disconnected. Oh, no, he has joined again. Yeah.
Yeah,
Yes.
am I audible?
Yeah.
Yes, you are.
Am I audible?
Yes, sir. Please proceed.
So what we found is that there are different levels in the different level of the bottle in which the medicines was kept. And after the succussion, we usually give 10 succussion. It was found that in the different level, in the upper level, in the mid level, and in the lower level, the nanoparticles were present and with different concentration. And this was a very astonishingly finding. And I'm sure that like this, there was one Dr. Belare who was doing some work in the Mumbai IIT. And similarly, there are so many other researchers who are doing work on nanoparticles and trying to find whether this new research development has something to do to validate the presence of particles of the medicine in very higher dilution. It is too early to say anything. The work is still being done. Let us hope in coming future we'll be proudly able to say that maybe not beyond Avogadro's number, there are proof of presence of homeopathic medicines in the particles. We are just crossing our fingers and waiting for the outcome.
Yes, sir.
Thank you.
Thank you so much, sir.
I do not know how long I will be able to be here. So if I log out, just do understand that it is because the unstable this thing network.
Sure, sir. Thank you so much, sir, for your comments. Now moving to Dr. Muktinder Singh, sir. Sir, what steps are necessary to enhance the global credibility and acceptance of homeopathy?
Very good evening to all, and my regards to Ifph and Dr. Sani sir for inviting me on this special occasion. So we all are celebrating World Homeopathy Day. So I have been asked that what should be done to promote the homeopathy globally or get its acceptance. So actually, if we see the current status of homeopathy, despite having no state sponsorships, despite having no official backup for any government except the India is hub of homeopathy, and we have Ayush department, and we all know that how much Ayush department has a stake of homeopathy in it. chunk goes to Ayurveda and very little remains for homeopathy. And all out of that also, at ground level, we hardly get very good support from the official. And all over world, homeopathy is hardly a recognized science in any of the part of the universe of the globe. But still, it is so proud to say that homeopathy holds the top place in alternative medicines. Non-allopathy fields, it is the number one practiced science. So homeopathy has survived on its merits. It has survived on its the basis, strong foundations, which was laid by our master Dr. Henneman. We sometimes end up doing the criticism of allopathy and talking about what allopathy does, what homeopathy does. But it is important. I usually say that first of all, there are three steps we need to take. Number one, the homeopaths need to meet the standards of the international parameters. We need to bring up our own standard. This is the most important part. When we believe in ourselves, we'll start thinking big. We are thinking very narrow minded. We homeopaths sometimes are very narrow minded, and that's the biggest obstacle. Once we start believing in ourselves, believing in our science, no one can stop us. And for that, we need to go out of our comfort zone. What happens is these days, most of the homeopaths, they are boasting about their success. They are talking of what they have done randomly, they have got results, what they have done in their little ecosystem. But the persons like Dr. Sahni, Dr. Subhash Singh, or the authorities who are working, we need to think big, we need to think global. To go global, we need to think global. So we need, number one, we need to have a confidence in ourselves. Secondly, we need to prepare ourselves, scientifically make ourselves. We need to invest in the research where we can prove evidence based case studies, evidence based everything. And third thing is most important is we need to pay back our science. What we are doing is we are just taking out of our science, not giving back to our science. So to make our science at par with the modern science, we need research, we need dedication, we need a collective effort, we need a selfless efforts. What I mean by saying selfless effort is that of out doubt we this is a commercial world, this is global, this is a capital words, but still having a big thought process, having a all acceptable thought process, thinking about others, how we can reach homeopathy to the masses, how we can help to underprivileged. Secondly, this was the big opportunity when we saw in the COVID. The contemporary science hardly had any solution, but our arsenic did wonders. There are now studies coming up. So we need to grab the opportunities. Sometimes we homeopaths, as the rightly said, that if a homeopath have his own anxieties, if homeopath has its own fears, he'll not be able to be an audacious presenter of what he can do, what his homeopathy can do. So we need some torch bearers, we need some strong ambassadors of homeopathy, we need some global thinking, and we need to reach to the core and suffering humanity because homeopathy has potential. From Similia to say we need to develop super specializations and we need to take part actively into the integrative the initiatives. What we're doing is integrative science, that if post surgical, oncological, the geriatrics, the pediatrics. So all this, I'll give you a little example. Let me know when my time is over. I'll just stop over there. So how much time I need to speak?
So you can take 5 minutes.
Okay. So I'll give you a little example that these days autism is a big challenge. We homeopaths hardly has understood, but I have in my practice seen that the original provings in Materia Medica Pura, in Herring Guiding Symptom, Allen's Encyclopedia, whatever has been formatted, is so relevant for autism cases. If we create a form, if we do it, and if we see the sensory symptoms are there in autism, so there are auditory seeking and auditory avoidant behavior, visual seeking and visual avoidant behaviors, touch seeking and touch avoid, tactile seeking and touch. We in homeopathy has so many symptoms, but we need to take it in as a project that we present those symptoms with evidence-based results and present to the world. World is looking for solution. We have solution, but we are not able to bridge that gap. World is looking for certain solutions in oncology. We already have those solutions, but we are not presenting ourselves to that platforms. So we are just trapped up because although we know that there are so many challenges, legal challenges, official challenges, academic challenges. Yes, challenges are we if we think of challenging, we should think of our master Dr. Hahnemann. What challenge he did not face? He was thrown out of many countries. He was not able to stabilize himself. He fought alone with the world. Still, he established this science and he managed to write 6 editions of Organ of Medicine, proving of almost Materia Medica Pura. We have chronic diseases. So he was writing. We are not presenting the literature, relevant literature to the world. This era of AI, this era of globalization through internet, through digitalization, a person sitting in his room has access to the whole world. So we need to organize ourselves. No doubt NCH and other organizations, they are doing very well in recent years. We have grown and we have seen the acceptance. India is becoming the hub of homeopathy. But still, if the efforts are not coming from the basic units, means we homeopaths, we are the basic units of our science in the world right now. India is the hub and we are like a body has a cell, so cell has to perform its function for the body to be healthy and growing. So we as a homeopath should take that initiative and start from myself to present my cases, to be evidence based, to be loud, to be audacious, to be confident in myself. And that confidence of our basic the root level homeopaths will become a movement and stand us will help us to stand globally. Thank you.
Thank you so much. Homeopathy has literally survived strong criticism and maintaining global standards, building confidence, and strengthening the evidence through collective efforts are key to its credibility, definitely. Coming back to Dr. Karnakar, sir, can you share examples where homeopathy has shown remarkable results in chronic or complex cases? Please unmute yourself.
So every homeopathy stated that said clearly homeopathy is born for chronic diseases. It is also not even educated, even illiterate men also stated. So homeopathy works very nicely for chronic diseases, but they stated it takes time. So the chronic disease definition itself stated it is a long time. It is compared with all other medical professions. So in other medical professions, lifelong treatment. But in homeopathy, so cut down somewhere, either 1 year or 2 years or third year, 3 year or life, not more than that one. But nowadays, a commercialization enters into the practice of homeopathy. They are also stated that one. Few men stated that one. So this is a lifelong you have to use. Or many patients who have suffering with chronic diseases, they said even simple allergic rhinitis, they have been continue years together while using homeopathy, will get the result otherwise. In my experience, such a case is not taken more than 6 months or 1 year period. So definitely after using remedies as per miasmatic theory, so body has developed adaptation and resistance to the causative agent. You enjoying what are the things which are allergic to the body, which are. So many cases are there, ma'am, especially the surgical cases, hemangioma, disc prolapse, tonsillitis, or adenoids. So many allopathic people are decided they are especially there is a need surgery tomorrow or day after tomorrow, otherwise. So in such a states, I educate my patients. I have to prescribe remedies. They are completely bring back to that one. Many patients are enjoying with their body parts, and that means permanent result. What stated that one? So similarly, recently I stated that one. So I have more what we call, especially in obstetric cases, the statement is there. The conception, pregnancy positive result is there, but they are not developing fetal movements in that sac. So in those states, they are advised, obstetrician advised induction of abortion. So in those states, they are suffering a lot. They lost complete enjoyment of pregnancy positive thing. In those cases, I have prescribed calcarea carb and followed most of the cases. Almost I treated more than 50 cases in my experience in such a state within 15 days. With recently also 1 month back, the same status already they are underwent abortion in the first time, and the second time, second parity, the same status has developed. I prescribed the drug on the basis of pathological similarity. So they have developed that fetal movements. They are decided, confirmed by the allopathic man also. Their enjoyment can create a smile in the face of homeopathic man that I enjoying a lot. Similarly, in the chronic cases, they are not responding to the allopathic drugs. Already old statement is there, where allopathic fails, homeopathic starts like that. In those cases, homeopathic shows very efficacious result. And one more, so a few cancerous cases, they are decided within few days, they are going to die. In those states, especially the patient admitted in ICU in a chronic uremic status or chronic comatic stage. So they are approaching, is it any possibility is there? First, earlier, I have started fear, is it possibility is there or not? Why we have to try it? They are giving opportunity. I want to show our homeopathic system. I advised our dilutions keeping on tongue or back of the hand or forehead. So many patients are recovered, they are bring back and discharged from the ICU beds. They are enjoying, especially chronic states, uremic states or kidney failure, CKD cases. In the creatinine is also 6.5 to coming down to 1 or around the normal levels. These are all the things. So in the cancerous cases also, I have succeeded. So few cases, they are prolonging their life. In my life, one case, completely bedridden. The allopathic man decided within 3 days, sure, you are going to die. That patient has recovered. She has wake up from the bed and she is doing normal activities. I also have preserving that video also. And more than 3 years, she was enjoying a life. So that's why if you see repertory or Metromedica, so many acute emergency or pathological cases, even failure. Some patients are on telephone conversation. They are consulting me. This was the status. This was the status. What I can do. All medicines are failed in that. So I have keenly observed. So I'm almost all the times I have to prescribe pathological prescription. Pathological prescription to the patient. It gives immediate relief to recover, and their tremendous progress is there. So in such a way, so obstetric cases and infantile cases, especially certain cases, autism or ADHD. Recently, I have treated one case. That boy was competent with a normal baby. Out of 50 marks, 49 he got. But he is not in normal school. Their mother was very, very happy. He never concentrated on studies. But this time, his own individually, he was tried doing hard work and represent the each and everything. So like that, so many cases I have enjoyed. So especially where allopathic people are left over the cases, I have taken up that those cases challenge, either maybe a surgical case or it may be a last stage, or in the what I have observed in my experiences in the last stage, either it may be a cancer or any consequences developed in the chronic diseases. So our drugs are provided a peaceful death to the patient. Peaceful means painless death. Painless, symptomatic suffering is reduced by taking either arsenic album, carbovage, or whatever, lacasis or lycopodium, whatever the drug of choice, renal stones, renal caliculi. So more than 5 years, he was passed every day few stones. So recently, he was approaching me in government dispensary. I was treated that case, even simple medorinum on the basis of totality, so pathological similarity. So immediately within 15 days or 20 days, the passage of stones were stopped. He was shocked. Something is going and happening in my body. Stones are not passing. Since 5 years, I have developed every day like that. So renal stones are obstetric cases, infantile, especially in the hemiplegia, hemiparesis cases, in the heart, hypertensive complications, especially cardiomyopathy, or in those cases also, our homeopathy shows tremendous result. So this is my experience, ma'am.
Excellent, sir. And my next question is to Dr. M.K. Sahani, sir. Sir, in an era of rapid medical advancement, how relevant is the concept of vital force?
This question's usually being asked by the students, especially the first year students who just entered into the homeopathy, and they feel that why we are being taught this vital principle. What is the relations? This is very relevant, and I think we all, as a homeopath, talk about the vital principle, but we have to make them understand why this vital force is important, because the concept of vital force was introduced in the Organon of Medicines later on, not as a primary his primary thoughts. I think it was introduced in most of the latest editions, like 4th and 5th editions and 6th editions onward. And this is there is another question also related to it, is that vital force was used in the 5th edition, and in the next editions it was used as the vital principle. So from force to the principle. So this is important questions. That is, and if you see in this light, the principle and the force, that means Dr. Henneman was just thinking that something from the outside, force has to be applied, but principle has to be followed. So principle is that represents the constitutional factor. So I feel that this constitutional factor is more important, and then that's why Dr. Henneman converted this word from force to the principle. Many people say that both are same. No, both are not same, because force needs the applications. It is something from the outside, but as our life is governed by the auto, it is auto. So it is very much. Because it is philosophical idea from the past, but if we look deeper, it aligns beautifully with the modern scientific understanding also. What Dr. Samuel Hahnemann described it as a vital force can be correlated today with regulatory system like immunity, neuroendocrine balance, and homeostasis. And that's what I wanted to point out, that this is the principle. System has become immune, system has become endocrine balance, homeostasis is affected. So we see the clinical practice that two patients with the same pathological reports respond differently, and this difference lies in their internal dynamic state or what we call the vital force. So disease in homeopathy is not just a structural change, it is a disturbance of this dynamic force, and our medicines act by stimulating and correlating this imbalance. So interestingly, the modern fields like psychodynamic medicines, mind-body research, and system biology are now acknowledging that health is not just a physical, it is also an integrated dynamic state. So I would say that concept of vital principle is not outdated. Rather, it is becoming more relevant in the modern science, where people are looking for the precision medicines. And precision medicines is just about looking the persons individually. And that's why I don't feel that it is not, we should not feel that it is outdated concept, but rather it is more relevant, and the world, the entire, all other systems of medicines are now coming closer to it. So I think this is not so much, this is not an outdated, this is becoming more and more updated. I say updated concepts is coming up with this vital vital force principle. So in the beginning itself, Dr. Hahnemann had that I pointed out that principle force to the principle. So this aspect is important to consider, and it is coming up. The time is coming up that it is becoming relevant for the every system of the medicines, everywhere it is being looked at. So I think my view is clear to you all. Thank you.
Thank you so much, sir. And now coming to Dr. Muktender Singh, sir. Sir, how can homeopathy contribute to current global health challenges such as lifestyle disorders and mental health issues?
Dr. Haniman, sir, our master has already mentioned it as the pseudochronic diseases. When I think many of us are not aware that Dr. Hahnemann was first to talk of these kind of lifestyle disorders in literature. If you go to the literature, you'll be surprised to see that Dr. Hahnemann can be called the father of community medicine and the father of this kind of preventive medicine. Secondly, these challenges, global challenges like depression, mental diseases, lifestyle disorders, cancers, and hypertension, thyroid, and hormonal disturbances. See, all these things, as Sir Dr. Sani sir was saying, that it is a vital principle. So the homeopathy's law of the dynamicity and law of individualization are the answers to these global questions. Because when we talk of individualizations, when we talk of dynamic dose, we all know simple gastritis. A person is given the antacid the whole life, and it ends up in complicating the system by developing the pituitary adenoma or pituitary pathology. So, but the reason is that I am not able to digest my food because of my anxiety at work, because of rudeness of my boss or my parents at my home. So my sensitivity to that why I'm not able to sleep, my anxiety, my stress is the cause of. But taking antidepressant pills, anti-anxiety pills, sedatives is not a solution to my sensitivity. So the Dr. Hahnemann's principle, homeopathy principle of the dynamic cause of disease and dynamic solution can prevent so many mental diseases. And I have seen, I'm again talking about autism because this is again considered as one of the genetic and neurodevelopment order. And this is due because it is called that the mobile white screen exposure is the biggest cause of children these days developing the virtual autism. Now, that what autism is a kind of escape from the world around. When the child is too anxious, it might be before birth, during birth, during pregnancy, and after birth. The sensitivity throws those kids into the shell. They withdraw from the active world. They go into their fancies, they go into their own world. The cause is their anxiety. Anxiety causes so many sensory symptoms. Anxiety causes so many sensory steamings. Now, giving them therapies is not a solution. Addressing to their anxiety, if it is an argentum nitricum case, if it is a belladonna case, if it is a stramonium case, if it is a veratrum album case. So, if it is a veratrum, the platinum and veratrum issue is the ego being hurt. If it is anxiety, arsenic, kalika, and stramonium and those fear remedies, they are the solution, not the therapy. Same way, if I talk of the lifestyle disease, mean hypertension or diabetes. Diabetes is a resistance conflict. So when I'm not getting adequate love, forsaken feeling is at the core of diabetes. So if I address the issues in this way, forsaken feeling, and then we have seen getting results. We have seen because lifestyle alterations, as Dr. Hahnemann, if you are aware, say Dr. Hahnemann has said that if a person is watching or getting, even listening, not giving rest to his senses, vision, hearing, taste, touch, smell, at least 45 minutes before going to bed. Our medicine is empty. See how beautifully he has talked it 300 years back. So these days, what we are doing is we are looking at screen and falling asleep till our eyes are drowsy. So do we think that this is a lifestyle? So lifestyle incorrections, lifestyle solutions, taking too much coffee, taking too much stress, not having adequate exercise. All these are the basis of lifestyle disorders. But Dr. Hahnemann has gone a step further, that not only correcting this, when the vital forces spun with the pathology, then even taking measures, preventive measures will not help. Then we have the answers in miasms, sora, psychosis, and syphilis. So homeopathy is not a kind of ray of hope, but it is the only solution. But again, my question is again, to be global, we need to think global, we need to present ourselves globally, and we need to first be the role model ourselves. So homeopathy is the only answer to lifestyle disorders. Not one of the, but it is the only answer. Thank you. You are not audible, Dr. Shweta.
Thank you so much, sir, for your views. And my next question is for Dr. Karunakar. Sir, how important is individualization in comparison to disease-based prescribing in modern practice?
It's a very simple answer, madam, in my point of view, but everyone feels from the beginning itself, when we are joined in the institution, they stated that, so we are treating the individual, sick individual, not the disease like that. Most of the timings, they are searching for what is the mental symptom, what is the alteration like that. In the present scenario, no one is ready to give their straightforward key causation or some other things. Most of the patients are come with diagnosological names or diagnostic names. Hahnemann himself, it was observed, this same problem will facing in tomorrow like that. He stated really earlier, don't act like a scientist. You cannot find anything. You are act like a craftsman. Why? Because so whatever the things which are available in the many times I have observed. So every man they try to what is the mental symptom, what is that one? Is it really alterations are there? Even alterations are there. Patient himself explained to us or not? So in the most of the timings, it's the biggest confusion in the minds of the physician, in the minds of the patient. Either it is a real problem or not. Why? Because most of the things, even suppose weeping, smiling, anxiety, fear, these are all the common phenomena. There is a slight demarcation is there. So when cross outside, so it is a problem. When within the on the borderline also, it's not a problem. So that's why most of the timings our homeopathic people, I prescribed on the basis of mental symptom, we won't get the result or like that. So in my point of view, Hahnemann is an intuitive mind. So when you have thorough knowledge of the Matra Medica, very easy to get the key points. And when you have thorough knowledge with the organon of medicine, so he has given many guidelines, especially chronic diseases and other thing. He never, and if you have a thorough knowledge of repertory, there are many ways of prescriptive methods are there on the basis of common symptoms, on the basis of uncommon symptoms, on the basis of mental symptoms, on the basis of pathological symptom like that. So these are all different methods. Don't stick on to the one methodology. So even in the totality definition is also, Hahnemann himself stated, totality is a logical combination. Even sometimes one single symptom constitutes the entire totality. Totality is not the quantitative one. So that's why don't try to hunt how many symptoms are we are getting from the patients or like that. So in Matra Medica, studying of Matra Medica, from the beginning itself to the end point, there are many key points are there. Even hair, even an eye, even a facial expression, even appearance from as a whole, like that. So you have to understanding the holistic concept. So every disease, many people are stated that in the nature itself, express everywhere there is a individualization. Even two leaves are green in nature, but they are contest or appearance, morphological difference is there. When you have to understand, so these are the things understood by when you have a craftsman mind, not the scientist. Scientists see the similarities in that one. So our homeopathic science is beyond that, beyond that. So that's why you have to understand the dynamic concept. So here, every disease have two phenomena. Hahnemann himself stated that one. So what is that one? Disease also having two types of symptoms. Disease common symptoms, disease individualistic symptom. Disease individualistic symptoms are more important to the homeopathic man. Disease symptoms are more important to the allopathic or other than homeopathy. Whoever is there, any medical profession, they are searching for the diagnosis. They are hunting for the symptoms for the diagnosis, but we are hunting for selection. We are break down the disease level. Suppose hypertension is there, at what parameter is high? That means diastolic pressure is more or systolic pressure is more. What is the vessel status? What is the pulse status? During that, what? So the expression of the disease itself individualized in every man. So same hypertension is there, never expressed in a similar manner in the two individuals. It's your duty to understand how it has expressed either in a common form, either in is a individual form. If it is a common form, you have to apply it is a chronic disease, the chronic disease principle to open up to get the individualistic characteristic of that individual. So this is one way. And another way, so in present scenario, most of the people are come with disease labels. I have asked what yes in during that disease what you have. I have this is one coryza is there. So nasal discharge is there. What is that one? So everyone stated that one nasal polyp. You have to see either right nostril or left nostril. What is the consistency or morphological features or how that. This is one way. In another way is so individual expression during that disease is more important. All individuals are not similar. They are having the same disease. Either it may be hypertension, either it is a fever or something. So the individual expression during the disease is more important, and disease individualistic expression is more important. These two phenomena. So that's why Hahnemann is most of the time started phenomena. Phenomena is more important.
Okay.
Disease is a dynamical concept. It is a
1 minute or
sir. Phenomena is more important. Phenomenological point is more. So try to understand the disease phenomena and match with the drug phenomena. It is very easy to no struggle at all in the day-to-day practice. This is my own experience. There is no difference with the existing. Any patient come with a label when you have knowledge of observing the phenomena aspects in that one clinical aspect. These are the two important aspects. Hahnemann clearly stated from the beginning to end, you have a knowledge of a disease phenomena and drug.
Yes,
Clinical
Dr.
aspects
Seda,
and other.
just only 2 minutes remaining.
Yeah,
Dr.
okay, sir. I finished.
Dr.
So that's
No,
why, yeah, Hahnemann clearly
Dr.
stated
Seda,
miasma.
more to Dr.
We have
Seda.
to understand very easy to prescribing and to get the positive result in that way.
Thank you so much, sir. Couldn't agree more with you. Very well articulated. And thank you, all of you, Dr. Karunakar, Dr. Muktender, sir, Dr. M.K. Sahani, sir, and Dr. Subhash Singh, sir, for such an insightful and enriching panel discussion. Your perspectives truly added depth and clarity to the understanding of homeopathy. Thank you so much, all of you. And thank you, everyone, for joining us today. Over to Dr. Dhanesh.
Thank you, Dr. Sweta, Dr. Karnagar, Dr. Sahani sir, Dr. Subhash Singh, and Muktendra Singh sir. With that, we come to the discussion of this day. And tomorrow we will have a big day in front of us. That's a celebration of Dr. Samuel Hahnemann's 271st birthday. Hope all of you will join us at the same time tomorrow. Thank you all. Right. It's over to Dr. P. Shaila to moderate the Malayalam session.